I am fortunate to be able to work very closely with 3 division directors, in addition to the deputy director and, of course, to the scientific director, John O'Shea. The 3 division directors, you've met one, who's Joan McGowan, who chaired an earlier session. You haven't met Dr. Laura Moen, who's the director of our extramural research program. Is Laura in here? I don't see her in here, but I know she's here. And now you're going to meet Dr. Susana Serrate-Sztein, but you're not going to really meet her because everybody knows her, I think. Susana is the director of our Division of Skin and Rheumatic Diseases and is going to chair the next session. She came to the NIH as a postdoctoral fellow in the National Cancer Institute, and she's been with the NIAMS since 1993, and her current responsibilities include overseeing a very large portfolio of projects that deal with the etiology, pathogenesis, diagnosis, treatment, and prevention of skin and rheumatic diseases. So, Susana, the floor is yours.
Thank you very much. Yes, 17 years, but they have passed very, very fast, 18. So because I had the opportunity and the privilege of working with wonderful people, scientists, patient advocates, and my colleagues at the Institute. Back 17, 18 years ago, we had 5 branches and 1 program. And one of the fun things that we did then, and we still do, program directors do all the time, is to attend a study sections. And that's how I met, or encountered, I should say, our first speaker today. Now, he doesn't know this, but back in the day, Alan Moschel, who was the branch chief for the Skin Biology and Diseases program, and I attended the GMA1 study section, and the vast majority of the applications in arthritis and skin were reviewed by that study section back then. And the study section had been struggling with a review of an application having to do with lymphocytes in the skin and a particular disease. And Alan and I were worried that the review wasn't going that well and that the score was not going to be good. And after a few minutes of discussion, a new member of the study section spoke up. And it was a very distinctive voice. And he said, you know, I'm not really sure we're doing the right thing here for this project. And then he went on to, in a very persuasive way, convince the study section that the critique was wrong and that the project was really wonderful and meaningful and was going to make a big difference in the field. And it turned out that the application got a good score, and it was funded, and it went on to be one of the most successful projects we have funded in the skin biology program over the last 10 years. So I remember turning to, after these new reviewers was criticizing the review and making an argument for the application, I turned to Alan and I said, who is that reviewer? And he said, that's John Stanley. And over the years, we have been very, very fortunate that John has shared with us his critical thinking and his insights. That's the way he approaches the C-science, and that's the way he approached the Institute as a study section member, as an advisor, as a council member. And critical he has been at times, and I think that has been very good for us because it has allowed us to think more carefully about what we were doing, and it has allowed us to grow. So John is a professor of dermatology at the University of Pennsylvania, and his numerous achievements have been recognized through several honors and including a membership in the Institute of Medicine. And John is going to talk today about pemphigus. I met our second speaker today, Dr. Jane Salmon, back in 1994, when I was brand new in the Institute, and I was enthusiastic about the genetics of lupus, and very naively decided to organize a meeting of funded investigators to figure out whether they could collaborate to advance the discovery of lupus genes. So I looked at all of our funded investigators. I hadn't been with the Institute very, very long time, so I didn't know them all that well. So I decided to invite Jane, who was a junior faculty member at the Hospital for Special Surgery back then, and she was a newly awarded NIAMS investigator. So I called and I invited her without having any notion of the turmoil that created, since the more senior leadership in that laboratory wasn't being invited to the meeting. So she handled that very graciously, and she came to the meeting, and she participated in the meeting. The senior leadership also came to the meeting. Anyway, but she really established her standing in the lupus genetics field very early on. And over the years, I have admired Jane because she represents some of the virtues and attributes of many of the most successful investigators that we are lucky to support. She not only asks the insightful questions, but her resilience and her perseverance in pursuing important, difficult questions is really something to be emulated and something to be admired. And the second characteristic that has impressed me about Jane is that she's always finding new collaborators and experts in very disparate fields to enhance her research. So every time I would meet her at a meeting or talk over the phone, she would say, oh, and I started this new collaboration with someone who is a cardiovascular researcher, and we are looking at cardiovascular disease in lupus. Or I am interacting with this wonderful group of obstetricians because we are interested in looking at the placenta in women with lupus. So it is a characteristic of very successful scientists nowadays to be able to establish these long-standing collaborations. So she's going to touch on that today. And it's been really a privilege for me to see the development of her work and how much progress has been made in lupus and what her contributions to the field have been. One of the main differences between NIAMS and the institute I worked for before, I was at the NIAID, the National Institute of Allergy and Infectious Diseases, before I came to the NIAMS. And that was back in 1990. And the only awareness, and I was working on the autoimmunity program there. The only interaction we really had with patient advocates was in the area of HIV/AIDS. And if you remember, those were not very easy interactions back in the early days. So it was really a revelation when I came to the NIAMS to see that there was such a strong interaction and friendship, really, between the patient advocacy groups and the institute and institute leadership. There was a coalition, and there were regular meetings, and there was a shared sense of purpose that was really something that we saw every day as we did our work. And one of the lessons that I learned about the patient advocates that work with NIAMS is that they are very passionate and they are very knowledgeable. And many of them are now from suffering the disease. Some know because they have family members affected. Some others work on the issues because of their own convictions about the value of the work that they do. But very early on, I was impressed by a particular patient advocate who has been doing this for many, many years with incredible grace, and that's been Amy Leung, who was also a member of our council. So it's been really my luck that I had an opportunity to interact with her and with all the panelists today. So I think they have wonderful talks prepared for you. There has been so much progress in the last 17 years, and I'm glad that you're going to hear directly from them what some of the advances have been in terms of scientific advances and also in the way we communicate scientific advances to the public.